I'm Dr. Vidya Bandookwala, a practicing gynecologist. Today being September, the month of PCOS awareness, and hence I'm here to speak about the condition. What PCOS is and what it means to us. Well, we all know that PCOS means polycystic ovarian syndrome. But what it has repercussions on our physical health and mental well-being is very important because it has its short-term and long-term consequences. When I say short-term, it means that PCOS can begin from the age of our pubertal growth, which means from the time we get our first period. But the first 2 years, the menstrual cycles can be so irregular that it is not diagnosed, and hence there is always a delay until some girls or some women don't even realize till they have problems in their 20s or 30s in falling pregnant, and that is when they realize that they had a condition called PCOS. So PCOS is a condition that creates an hormonal imbalance in our body, and it leads to an excess of male hormone which we already have in our body, but an excess can cause changes in our health. And what are the changes that we see? We see changes in our physical appearance and our metabolism. The first foremost is our periods. One, they get delayed, they get irregular, you can have scanty flow, or sometimes you may get breakthrough bleeding, as we say that if you don't get your period for 3-4 months, you suddenly get a breakthrough and heavy flow of periods, and this is what it does to our menstrual flow. Some of the girls can experience just 2 or 3 cycles in the year, and the normal periods that a woman should get is every 28 to 30 days. But they can probably not get for even 3 to 4 months. And this can have other problems. The second is because of the androgen being excess, the male hormone being excess, they experience a lot of changes in their physical appearance in the form of increased hair distribution, which means they have increased hair growth in unwanted areas such as the upper lip, the chin, the chest, and all over their body, just like the male pattern, which may not feel comfortable for any woman or a girl. They may have acne, eruptions on their face, their chest, and their upper back. All this can disturb and have a body image shaming feeling that a woman has, which I think today, as we all say, we must own up to our body, but going through such a phase can mentally, put them down. They tend to have low esteem of themselves and hence a low quality of life. Also, there is an increase in the insulin level which disturbs the metabolism and helps in gaining more weight, leading to obesity. Now, all these things, the issues become like a cascade, a vicious cycle, which means this has to be addressed at the right time. We all know that PCOS is not a life-threatening issue, but eventually in the future can cause later consequences in our health in the form of having type 2 diabetes, glucose intolerance, high blood pressure, related issues that we could land up with a stroke, cardiovascular diseases. We could have dyslipidemia in the form of increased cholesterol level, and patients of PCOS are more prone to uterine cancer because of the increased excess hormonal stimulation to the womb. So today, let us go back to while we diagnose this early. I think any girl after her menarche, that is after her first period, in the 2 years that we see changes in the adolescence, we take it as normal changes of increase in her weight, having irregular cycles. But after 2 years, if you come across having irregular pattern of menstrual cycle, or you find that you are having increased hair growth in unwanted areas, or you land up having extra acne eruptions, do not sit silent. I think it is time for all our young girls to raise a voice and address it to their healthcare physician. Today, we are so prepared with the treatment profile, though we know there is no definitive treatment, but we can address the symptoms and prevent these girls from going through all the disastrous effect in the long term. So it is time for us as young girls or women to be advocate of our own body. We must not get away with, saying that these are all normal changes. No, this is not normal. This has to be addressed in the right form, and there are ways to help And the best way to help is by self-help, which means that the first line of treatment that we ask the patient to do is a change in the lifestyle. Today, being a very competitive era, our girls are in all form of life, all walks of life, I would say, that they are just running here and there, doing their best to have the best form. But in the bargain, they are neglecting their own health. So we would like them to reset themselves, change their lifestyle, decrease their stress level. If they have obesity as a part of PCOS, they must try to lose weight, eat healthy food, get good sleep, because this is the first way or the first line of treatment that helps them to get over the PCOS symptoms. In case if it does not work well, then there are the pharmacotherapy which we will bring forward to help them in the treatment profile. In case there is problem in the skin issues of acne and hirsutism, as we call excess hair growth, we have our dermatologist, we have our nutritionist. So in conjunction with all these specialities, we can work towards the management of PCOS symptoms. Those women who are in their 20s and 30s and who are having problem in getting pregnant, well, there is nothing to be worried, but just by losing weight can help in their own egg quality to get better, and they will probably release their egg timely. Or there are other methods which we can help in doing so. So today, I don't think you should look at PCOS in a very scary manner. We are able to manage it if you come and address it yourself. So as I said, that being an awareness month of PCOS, the Hetero Healthcare has formed Vidhita, an initiative to address the concerns of PCOS and how to manage PCOS. So today, while I address you, I would say that instead of having PCOS as a definition in the medical term, why not I define PCOS is what our motto should be, where P, which stands for patience, in helping ourselves to change our lifestyle in a healthy way. C, which means we should be compliant, we should be consistent with bringing about the change, and of course care for our mental health. O, which means overall understanding of our condition and be obsessed with a healthy living, and S is self-help, without which the other three means nothing. So here with Vidhita, we are here to help you understand the condition and treat it at the right time. So I believe that catching them young will later on prevent us from all the consequences that PCOS can do. So it's time, with the initiative of Vidhita, let us all reset our lives and redefine PCOS. Let us be a part of Vidhita initiative by Hetero Healthcare. Thank you so much.